morning and welcome to Deuk Spine Institute. It is October 21st, 2025. We'll be performing live spine surgery today for your viewing pleasure. Our patient comes from New York. She's actually here today with her sister. Her sister is also having back surgery. Both ladies have suffered with back pain for 30 years. Now, her back pain is coming from 3 herniated discs and the left SI joint and the left piriformis muscle. This patient has five causes of chronic back pain, each a specific cause, each a specific treatment. For the 3 disc herniations, degenerated discs, the treatment of choice, the best treatment in the world, is the Deuk laser disc repair, performed here at Deuk Spine Institute by me, and that's what we'll be doing this morning. The treatment for the piriformis syndrome is the Deuk piriformis release, patented procedure as well. And finally, the treatment for the left SI joint pain is the Deuk plasma rhizotomy of the SI joint. So we're going to start by performing surgery on the 3 discs with the laser. We're going to repair these 3 discs and get rid of the back pain. We'd love to do a discogram if possible. We're going to get started. If you have any questions, call me. Not call me, but write your question down for Henry, and he'll call it out so that you'll hear the question and you'll hear my answer, okay? So text your questions in. In the meantime, Henry, would you mind sharing with our audience the 30 different causes of chronic back pain? I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. And welcome back. You can see from our video that there are 30 very specific causes of chronic back pain. Deuk Spine Institute is the first in the world to identify those 30 causes, and we're the first in the world to come up with cures to each of the 30 causes of back pain. We don't have a lot of patients coming here with chronic back pain that have something going on other than the 4 most common causes of back pain. The 4 most common causes of chronic back pain are disc injury, which she has 3. That disc injury is disc herniation, bulging disc, ruptured disc, extruded disc, protruded disc, slipped disc, and degenerated disc or spondylitic disc. Those are the disc injuries. They're all the same, by the way. They're just a bulging disc is the beginning and the degenerated disc is the end of the spectrum. It's kind of like being young and old but still being a human. You're a young human, you're an old human, and you're everything in between. So all those other categories of disc protrusion, extrusion, herniation, those are all just in between the bulge and the degeneration. What causes a degenerated disc? Well, not treating your disc bulge early enough and letting the inflammation happening in the tear destroy your disc. That will destroy your disc if you don't get the Deuk laser disc repair early enough. The disc will get destroyed. Second most common cause of chronic back pain, the facet joints, F-A-C-E-T. She does not have facet pain as far as I can tell. Third is the SI joint, which is right here, SI joint. And fourth is the piriformis muscle. Okay, so we have the fourth is the piriformis muscle. Now, those 4 causes of back pain equal 99.5% of all people's chronic back pain. Those 4 things. All right? You got to get control of that. We're way away from that. Now, when I asked her where your back pain is, this is where she showed me. In this area here, this area here, this area here. So she had the disc area, the SI joint area, the piriformis area. And I verified the discs were indeed damaged on the MRI. You can see it on your screen at the bottom corner. The SI joint is very easy. I diagnosed that clinically. And the piriformis, same thing. So, is she ready? We're going to confirm the discs are indeed the cause of her pain. Are you having any back pain? All right. How bad is that on a scale of 1 to 10? How high does that go? Give us a number. What's the highest number? 1 to 10. You got to speak louder.
Say the number.
How high did the pain go? How high did the pain go?
Can you say it again?
You guys see the tear on the x-ray? Show us
Yes,
the
we
tear.
do.
The tear is in the back of the disc. That's where her pain is coming from. All right, she said 8 out of 10. Is it better now?
Is your pain better? Are you feeling better?
All right. Are you having any pain right now?
Are you having any pain right now in your back? No.
How bad is that pain? On a scale of 1 to 10. Show us the tear, Jordan.
Give us a number.
Look at the white arrow. Jordan's going to show you the tear. How high does the pain go? On a scale of 1 to 10. That tear is where her pain is coming from.
Can you open your eyes for me? Good. Open your eyes. Good. Can we ask you another question? Are you having any back pain right now?
How bad is that pain on a scale of 1 to 10? Folks, this is called an evocative discogram. We want to see whether this disc is causing her pain. 9? All right. She said 9 out of 10. Is that where you get your back pain every day?
Is that where you have your pain?
Is that where you get your pain? Yes? All right. So it's concordant. So we have 8 out of 10 at 3-4, 9 out of 10 at 4-5. How bad is that pain on a scale of 1 to 10? You can see her back arched. How bad is that?
Give us a number. What number?
10? All right. So that was a 10. Is that where you get your back pain every day?
Is that where?
Yeah? All right. She said yes. All right. So we've got 8, 9, 10. All 3 discs were causing pain, and the pain comes from a tear in the back wall of the disc. That's what I discovered here at Deuk Spine years ago. By cleaning that tear, we can get rid of her back pain. This is how much blood we're losing for the whole surgery. Now, if we had done the alternative treatment for her, which is a fusion, the incision would have been from here to here, that big. I've done 1,000 of these fusions on people's lower backs. And we would have done what's called a T-lift, T-L-I-F. She would be in pain from the surgery for months. And the muscles die, they turn to scar tissue, they cause pain for months as they're dying. That's why people take narcotics after fusion. But she's having laser surgery instead. Better choice. Fast recovery, better results with pain reduction. All right. You want to start at 5-1? That's fine. Let's start at L3-S1. Thanks. Got to work on that a little, Berndays. The heart rate is not the right indicator. All right, any questions?
Yes, we have a question coming from Davo on YouTube.
Davo, D-A-V-O?
D-A-V-O, correct.
Take it out.
Saying, Barev, Doc.
Barev.
I have 2 badly degenerated discs that have collapsed down to about 4 millimeters height and are killing me with a foramina narrowing. Any hope for me other than my A-lift, which is already scheduled?
Yeah, Davo, you should not have an A-lift. You don't need it. An A-lift is the wrong choice. I don't know if Davo's male, but A-lift has a tendency to cause you to not be able to get an erection after the surgery. They're going to cut the sympathetic nerves in front of your spine, destroy them permanently for the rest of your life. You won't be able to get an erection. You won't have retrograde ejaculation. Please look up sexual dysfunction after A-lift. Plus, people lose their leg sometimes from A-lift when the surgeon accidentally cuts the vein and does damage to the vein. So you want to avoid A-lift. It is the worst spine surgery you can do. And yes, the Deuk laser disc repair, this surgery is all you need done to fix your back pain. Okay, it's not coming from foraminal narrowing. It's coming from the tear in the back of the disc. Do not get an A-lift, do not get a fusion, do not get an artificial disc. They're all unnecessary, invasive, dangerous procedures. Look what happened to Tiger Woods. He just had his 6th back surgery on Friday. He had fusions and microdiscectomies, the same treatments your doctors recommend for all of you. They don't work. Think about it. Tiger Woods has the best surgeons in the world, except for me. He didn't come to me. He should have come to me. But he has access to the best artificial disc surgeons, the best treatments. Money is not the issue. He's destroyed his whole career because he's made bad choices of having procedures like ALIF, which he had done, by the way, ALIF, and now he had another surgery because the ALIF caused adjacent segment disease. Do not get fusions. Do not get laminectomy. Do not get discectomy. What you need, folks, there's only one surgery you need when you have a disc problem, and that is the surgery you're watching right now. That's why this patient traveled all the way from New York to come here. Her doctors in New York told her she's crazy to come to Florida and let some guy operate on her back. They're the ones who are crazy. They're crazy because they don't care about their patients. All they care about is losing the money that the patients are paying them to come to their office and have their treatments. That's what medicine in the United States and the rest of the world has turned into. It's all about people protecting, doctors protecting their money, their revenue coming in from patients and insurance companies. That's not what medicine is about. Medicine is about providing our patients with the very best treatment in the world. And the best treatment in the world is what you're watching right here, right now. I can do fusions. I've done 1,000. I've done artificial discs. I've done fusions. I've done laminectomies and discectomies for 30 years. I don't do them anymore because they are bad, 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 bad surgeries, even though I do them very well. All right, this is the annular tear. You're seeing right now we're inside the annular tear in the back of the disc at L3-S1. I'm removing pieces of herniation from the tear. These pieces of herniation are stuck in the tear, causing pain. And by removing them, I'm going to get rid of her pain. That's all she needs done. She doesn't need fusion, ALIF, laminectomy, microdiscectomy, discectomy, endoscopic discectomy. People don't need any of that junk. It's time you all learn the truth. You're not going to hear the truth anywhere but here. Why? Because I've stopped doing treatments that are bad for patients, and I'm willing to talk about it as a neurosurgeon. Okay? I'm willing to tell you guys the truth. Other doctors will not tell you the truth because it's going to result in loss of business for them, and they may not even know the truth. Right? Remember when people used to believe the world was flat? If you talk to somebody who believes the world is flat, they will tell you the world is flat. They're not lying to you. They truly believe the world is flat. Now, in reality, they are lying, saying the world is flat, because we all know the world is not flat, it's round. But they believe the world is flat. That's their belief system. You understand? And when you talk to spine surgeons, they believe fusion is your best option. Maybe ALIF is your best option. But they are lying to you because it is not your best option. They just don't realize there's better. Just like the flat earthers don't realize the earth is really round. You know, this is of course going back thousands of years, but even today there are people who believe the earth is flat. Those people are just crazy. All right, let's show the audience why do these disc injuries like herniated disc or degenerated disc, as our good friend Davo has, why do these disc injuries cause so much back pain in patients? It has nothing to do with foraminal narrowing. Zero.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see that The sequence of events for causing back pain from a disc injury is trauma, some trauma to the disc, which causes a tear in the back wall of the disc. That wall is called the annulus fibrosus. Annulus means ring in Latin. Fibrosis means fibrous ring. The annulus fibrosus is the wall that wraps around a disc. It is, for all intents and purposes, what we call a ligament. Ligament holds bones together. The bone that the annulus is holding together is the vertebral body above, the vertebral body below. It holds those two bones together. And it just so happens that inside of those annulus ring, in the center, is a jelly called the nucleus pulposus. Now the nucleus pulposus comes embryologically from a structure called the notochord. And the notochord is very important in the first trimester of fetal development, where it oversees and directs all the 3 germ cell layers to become the endoderm, mesoderm, and ectoderm, which eventually become the lining of your lung and intestines and kidneys, bladder, which is the endoderm, and then the mesoderm becomes muscle and bones, tendons, and the ectoderm becomes your skin. So for your primary germ tissues as a fetus in the first trimester to become those structures, you must have the notochord, which then directs those tissues to become what they are in the adult. Now when the notochord is done, it actually becomes the nucleus pulposus and hides away in the middle of your disc, surrounded by the annulus fibrosus, until you undergo an injury. That injury, that traumatic injury, tears the wall, crushes the annulus, and fragments the annulus into fragments called disc fragments. And those fragments find their way out of the annulus. Now, who told me this? Nobody told me these things. I had to figure them out. Because the truth is, doctors don't know what causes back pain. Doctors don't. I was brought up to believe back pain is nonspecific. There is no cause. We don't know the causes. But over the years of treating patients, I discovered the causes, and now I publish them for you so you all can know the causes. When your doctor tells you they don't know the cause of your back pain, understand that we do know the cause of back pain. We now do at Deuk Spine, but you can't go anywhere to any doctor. They won't tell you because they don't know. Okay? It's just like building an electric battery for a car, like a Tesla, right? You don't know how to build an electric battery. I don't know how to build an electric battery, but Tesla does. So if you want an electric battery for a Tesla car, you need to get it from Tesla. If you want to know what causes your back pain and how to fix it, you need to go to Deuk Spine Institute. Deuk Spine Institute will be a future household name because we have the technology to cure back and neck pain, and nobody else does. So if you want to get cured, come to Deuk Spine. Stop getting procedures that are dangerous for you, that are unnecessary, and that cause complications. Look at Tiger Woods. He's had 6 back surgeries. He's still in pain. He's got addicted to narcotic painkillers because the doctors that did his surgery didn't do the right treatment, okay? And remember, he had access to the best surgeons in the world. He just didn't know about Deuk Spine, unfortunately, and didn't come here, but he should have come here. We would have saved him $1 billion in lost money, and we would have saved his career. Our golfers go back to golf within a few weeks, and they're normal. They have no back pain. That's the Deuk Spine difference. You want to have a normal life? After getting your back fixed, you come to Deuk Spine Institute. This patient did, all the way from New York City, despite the fact that her doctors told her she was crazy to come here. She had faith that we could fix her. And she had that faith, not blind faith, but because she watched Henry's videos, his testimonials, and all the other videos that Henry and I have produced, trying to educate the public about the fact that we can now cure their pain safely without invasive surgery like ALIF. ALIF, very bad idea. Most dangerous fusion of the back you can possibly have. All right, any other questions?
Yes, we have a question and comment slash seeking advice from David on YouTube
Hi, David. Welcome.
saying, is that the front my S1, L5, and L4? I can get money. I can't stand long, especially if I have to control my hands. I use crutches. I just want to be repaired. I'm not into surgery syndrome, but repair only.
Yeah. David, Deuk Spine Institute can cure your back pain. We've cured thousands and thousands and thousands of patients. All right? And all you need to do is come here and let me help you and get you off your crutches, okay? So to do that, my advice is, number one, go to our website. We have a form you fill out for a free MRI review. That is your doorway you walk through to start healing your back. You must get a diagnosis. I can't magically determine what someone's diagnosis is. I must do an examination. That examination we do via Zoom. Every week I do Zoom examinations with people, and I do it for free. There is no cost to you. There is no charge for that Zoom examination. Everyone gets one free Zoom call with Dr. Deuk Majan. I will look at your MRI. I will look at your back. I will examine your back with your help, okay? And at the end of that call, I can tell you why you have back pain. And remember those 30 different causes? I will tell you which of those 30 causes is causing your back pain. Now, of course, you have to have the back pain when I do the call. If you load yourself up on narcotics and you don't have any back pain, then I can't figure out where your back pain is coming from. So when you do the Zoom call for free with Deuk Spine, with me, you're going to want to be able to tell us where the pain is coming from. That way I can identify the source. As long as you can tell me where your pain is on the examination, I'll tell you what's causing it. Because I know anatomically where all those structures are. So I hope I see you on a Zoom call soon, David, to help you. All right, we are at L3-S1, the hardest disc to get to, but we were able to get to it. I've got just 1 minute left and we're done with this disc, and then we're going to move on to the second disc, which is L4-5. In the meantime, we showed you how discs cause back pain. It's from inflammation right back here at the back of the disc, and I just removed it all with the laser. That laser is 1 millimeter wide. That's how wide it is. So it gives you perspective on how small everything is that we're working on here. All right? We're done here at 5-1. I'm going to put some antibiotic, and we're going to get the tube out. I'm just doing my last few touches. Yeah, we're done. All right? Let's show the audience how these lasers can be used to cure back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. You can see from our video, once you have a tear in the back of your disc, which everybody gets tears in the back of their disc, but not all disc injuries are painful. And that's why it's really hard for doctors to figure out which of those disc injuries needs to be treated. Well, you only need to treat the ones that are painful. And Jordan, show us again on that x-ray exactly where the tear is that causes back pain. This disc is painful. Jordan is showing you with the white arrow where the pain comes from. It's that tear right there. That's where I'm heading to right now. And I'm going to go in there and I'm going to find that tear and I'm going to fix the I'm going to fix the source of pain. That's good. Yeah, we're good. All right, so the dilator went in very easily because the tear is huge. She's had these tears for 30 years. She's had 30 years of back pain. Nobody in New York has fixed her. She said, enough. I spent 30 years in New York City trying to get my back fixed. No doctor fixed my back. She's just lived in pain. It's gotten worse. So she decided, I'm going to go to Deuk Spine, and we're going to cure her pain. I'm confident. God willing, we're going to cure that pain. She's going to be thankful she came here and wish she came 29 years ago. All right, any other questions?
Yes, we have a comment and a question coming from David once more on YouTube.
Sure.
Asking, I was told my surgery requires to open my front and remove. How many surgeons are available to do equal quality?
There's nobody else in the world that does what I do, that I'm aware of. I haven't trained anyone, and I am the one who pioneered this technology. That's like saying how many people can build a stealth bomber. There's only, I believe it's Northrop Grumman, right? Yeah, there's only one Eiffel Tower. There's only one Rome. There's only one. Right now, there's only one. Someday, there will be more. There'll be more Deuk Spines all over the world because we are curing people's pain, curing it permanently with one treatment. And we want this business to be everywhere, but we can't do it on our own. We need your support. Money, there's no money tree growing in the backyard. So my father used to say to me when I was a kid, if I wanted something, he would say, we don't have a money tree growing in the backyard. You have to earn the money. You have to earn it. So, of course, we don't have a money tree. We get no funding from anyone but our patients. We get some insurance payments, but very little. The insurance companies, you have to fight them and battle them just to get any money from them. They never pay you fairly. They always try to cheat you, the doctors and the hospitals. So the point is, we'd love to have more of this technology all over the world. That's my vision. Someday, Deuk Spine Institute will be the cure of back pain someday of the world, right? Imagine if cancer could be cured today. Wouldn't we all run there and get cured if we had cancer? Absolutely. Well, why is back pain any different? Back pain is a killer. People die from back pain. They die from the treatments, from surgeons, okay? Like Ozzy Osbourne, he just died. He had spinal fusion. His spinal fusion that Ozzy Osbourne had led to pneumonia because they went through his neck to do a ACDF for fusion, and they injured his breathing tube and swallowing tube. He then aspirated food into his lungs, developed pneumonia, and then the pneumonia became sepsis, which is an infection of your blood and organs, and then he had what's called multi-system organ failure and died. He died from the surgeon's treatment, the complications, okay? So when you talk about back pain, it's worse than cancer. Back and neck pain kill more people in the world than any other condition. It's just ignored by people, ignored by our health system, ignored by doctors, ignored by everyone. And I'm tired of it being ignored. I've seen too many lives destroyed by back pain and neck pain to stand by and just watch it happen when I know that I can cure those people and give them their entire life back to do everything they want to do without pain. That is now possible, but only at Deuk Spine Institute. We're the first in the world to discover the cure to back pain and neck pain. We're the first in the world to offer curative treatments. All these other doctors, they offer pain management, pills, shots, stimulators that try to cover up the pain for a short period of time. We cure your pain for your lifetime. That's the difference. And we do it safely. with treatments that do not have complications. We've never had a complication with this surgery you're watching right now. 20 years of this surgery, 2,712 of these surgeries I've performed to date. Not a single complication. Nobody dying from my surgery. Nobody paralyzed. Nobody nerve damage. So this is an incredible discovery we're trying to share with the world so that you people can benefit and enjoy life. Okay? So back and neck pain kill more people in the world than anything else. Either through suicide, through treatments that don't work, through drugs like opioids that cause addiction and then they become heroin addicts living on the street. 80% of heroin addicts on the street were people with chronic back and neck pain that were treated by their doctor with opioid narcotics, who got addicted to the opioids, and then eventually, because opioids are expensive to buy in the pharmacy, you're paying $10 a pill sometimes, depending on your plan, and insurances don't want to cover it anymore. So you resort to the street drugs, and they say that in the 80s and 90s, 80% of the heroin addicts on the street were people with back and neck pain that lost their jobs and lost their lives because the doctors got them addicted with oxycodone, OxyContin, okay? So it's a serious problem. A lot of people don't see any way out and they commit suicide. I mean, who wants to live with chronic pain? Nobody. And when the doctors are telling you there's no cure, they just take these shots, take these pills, and keep coming back and paying us, it's a lie. And it's time that people know the truth. The truth is we can cure your back pain, but it can only be done by certain procedures with certain diagnostic abilities. And that's what Deuk Spine does. But fill out our free MRI form and get a free consultation. Find out why you have pain. All right, Henry, any other questions or comments?
Yes, we have 2 comments coming from L3-S1 on YouTube.
L3-S1, welcome.
Saying this has been a very interesting to watch. Thank you for this live stream.
Oh, you're welcome.
Insurance scams everyone. Patients,
Yes.
physicians, hospitals, and it's not just medical insurers. It's every kind of insurance.
Yes. Amen. 100%. You are correct. You are correct about that insurance. But when it comes to people's health, it's different, Think about it. If your insurance doesn't cover your roof on your house or something, yeah, that's terrible. They should. But when they don't cover a treatment that will keep you alive, keep you from suffering every day, that's a new level of evil. That's the worst evil in the world right there. Huh? You can replace your roof, you can even change your house, but you can't get out of your body. Your body is the body God gave you. You're stuck with it. Now we can cure pain. But the insurance companies, they don't want to pay for treatments that work because they know patients will go and get those treatments and they'll have to pay more claims, more money. Less profit for them. I don't know any insurance company that isn't profitable. I know a lot of doctors and hospitals that are going out of business because they don't make enough money. They don't get paid enough from the insurance companies. The insurance companies denied 850 million medical claims last year, according to the Wall Street Journal. That's an article published on February 12th of this year. Go look it up. Wall Street Journal, healthcare insurance denials, 850 million in the United States alone. Worldwide, probably billions. And every one of those denial of payment by the insurance company equals more profit for them. And that should not be allowed. I hope to God Donald Trump someday figures out what's really destroying our country is not the Democrats or the drugs, though those are important issues. It's our health. Ultimately, we've lost our health in this country. When I was a kid, America was #1 in the world in health. We had the healthiest country, #1. And everybody knew it in the world, and everybody expected America to be #1. Now we're number 64 in the world, at least last time I checked. And before that, we were in the 40s. And it's just getting worse. We were 64th last poll I read. 64th in the developed world. Unbelievable. We're the 64th most healthy country. We should be number one. The only reason we're not number one, we have great doctors, we have great medicine, we have great medical schools and residencies. We're not number one because the insurance companies are keeping us from being number one. Yeah. All right, any other comments, questions?
At this moment, no current comments or questions.
Great. So then let's show the audience why this surgery they're watching, the Deuk laser disc repair, is the best treatment in the world when you have back pain. Hi, I'm Dr. Deuk Majan. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. You can see from our animation that there are many choices patients have for treatment when they have problems with their spine. But all those treatments, you go to the surgeon and ask them, will this cure my back pain? They will tell you no, it will not. There is only one treatment in that video that will cure your back pain, and that is the Deuk laser disc repair. Why? It's the only treatment that treats what you're looking at right here. You guys see that? That's the tear. That is the tear in the annulus. This is where the pain comes from. Literally, that right there is causing pain. And when I take this 1mm laser and I remove it, it gets rid of the pain. This is what cures the pain. Nobody else does this surgery, therefore nobody else can cure back pain. Okay? Any questions?
Yes, we have about 2 questions. Next one coming from Lanu on YouTube.
Well, I was wondering where Lanu was.
Asking a curious question. Have you ever had a headache during surgery? I know some surgeons had headaches during the surgery, but it didn't bother them at all.
No, I never get headaches. I thank God every day that I have reasonably good health. Of course, I have my own issues. But for the most part, I've never really had a headache that has affected my performance in life, my work. There are many causes of headaches. The most common cause of headaches is just having the wrong visual correction, not having the right glasses or contact lenses. That is the number one reason people get headaches. It's called eye strain, straining of your eyes, because your visual acuity is off, okay? And other causes of headaches include migraines, but even herniated discs in the neck will cause headaches. A herniated disc in the neck, which is what we fix with this surgery, laser surgery, can cause severe debilitating, what's called cervicogenic headaches, which are headaches that come from the back of the neck and go up to the head, typically in the back of the head. We also cure occipital neuralgia headaches, which is headaches that come from the occipital nerve. Specifically, it's getting pinched usually at C1, C2 as it exits the between the two vertebrae. But thank you. I've never had the headaches. Thank you, though, for asking.
Next question is coming from LETH once more on YouTube,
Excellent.
asking, what is the current estimated cost of the Deuk laser disc repair? I'm sure my insurer won't cover it.
Yeah, great question. It really just depends on how many discs you're having fixed. If it's one disc, is it one side or both sides? If you have leg symptoms on both sides, you're probably going to need both sides fixed. If you're having leg symptoms on one side, you may only need one side fixed. So if you're talking about cervical disc, that's different. We only do one approach per disc. It's different than the lower back. So thoracic, same thing. It just depends on which discs we're fixing and how many sides we're fixing. And that just depends on the symptoms. So to get your exact cost, do the MRI review. It's very easy. It's free. It'll take you 10 minutes, and I will tell you exactly what needs to be fixed. And then once I know what needs to be fixed, you will get a call from our office, and they will tell you exactly what the cost will be. No questions. You'll always know within a few days of your MRI review what the cost to do your surgery would be. Remember, disc pain is not the only source of back pain. I would say if you have a disc problem in your back and it's causing back pain, there's about a 90% chance there's other things also causing back pain besides the disc. And we don't know what those other things are because MRIs never tell you where pain comes from. So I have to figure that out. We use our proprietary exam called the Deuk spine exam, which you're not going to find anywhere else. That exam tells us where your pain comes from. I can do that exam on Zoom. I cannot do it just from an MRI report. I need to see the patient. I need to physically examine you, visually examine you. So the Deuk spine exam, which is how we diagnose everyone's back pain and neck pain, requires me to see you. And at the same time, I'm looking at your MRI. And I'm not talking about your report, I'm talking about your images. I don't trust the radiologist reports. Radiologists are not clinicians. Clinicians are doctors that treat patients. Radiologists just look at report or MRIs or images and they just give you a report of structural findings. That's fine if you have cancer or if you have a fracture or if you have tumors. It's not fine when you have back pain. Radiologists will never be able to tell you where your back pain comes from. Only a clinician can do that, like me. And to do that, I must examine you. Okay? Think about it. When was the last time a radiologist examined you? They don't. Radiologists just sit in a dark room and look at pictures all day and make reports. They have no idea where your pain is or where it's coming from. All right, we're on the last of 3 discs that we're repairing, and I've got about 4 minutes left, and then we're going to end this stream. We're going to pick up with a new stream where we're fixing this patient's sacroiliac joint on her left. She has sacroiliac joint pain from inflammation in that joint. It will not go away on its own. We're going to make it go away. All right. Any other questions?
Yes, we have another question from Alanu, once more on YouTube, asking, sorry, been away for a while. I was too busy making money from the wonderful stock market. I'm curious, does Deuk Spine stock exist in the NYSE?
Well, Lanu, first of all, congratulations. I'm so happy to hear you're making money. That makes me happy for you. No, Deuk Spine Institute is a very small company. We're literally a small little building here in Florida. We are a tiny, tiny company. Someday we will be a very big company because of what we do, and everybody's going to want it. But right now, you found us at our beginnings when we're still small, and we have one little building. We have about 60 employees, and we have no stock to trade. Someday I hope we do. I hope we become a publicly traded company. That's my wish. That's what I expect. Would love the help from people. Honestly, I'm just a doctor who stumbled upon this cure, these cures and treatments, and like most doctors, I'm not an investor in stocks myself. I've put all my money into my company, buying equipment, paying my employees, so we can grow and help more people. That's what I want to do. I want to cure every single person of back and neck pain in the world. That's my goal. And it won't happen in my lifetime, but after I'm gone, maybe it'll happen. God willing. All right, we're just about done. Any other questions, Henry?
No current questions. So we do have a comment from LETH once more on YouTube saying, I am on the West Coast and have to leave for work. Thank you again.
My pleasure. Have a wonderful day. Thanks for joining us. We'll be streaming all day today, and we got actually 4 surgeries on Thursday too. So you can always watch our surgery streams on YouTube or on X or Facebook. All right, last zap and we're done, and we'll end the stream. Any other questions?
At this moment, no current questions.
All right, just remember that glass fiber is 1 millimeter wide. 1 millimeter. You can see the tear, and for reference, since the glass fiber is 1 millimeter, you can see the tear is about 3 or 4 millimeters. That's it. It's tiny. The body will heal it quite quickly. Grab her. And we're done. All right, you can go ahead and end the stream, and we'll be back with our SI joint DPR.